In this video, I am giving you complete detail about the COVID-19. So first of all, we should know about the COVID-19. And basically, what is COVID-19? What COVID stands for? So COVID-19 caused by the novel coronavirus SARS-CoV-2 emerged as a global pandemic in late 2019, leading to unprecedented disruptions in societies, economics, and healthcare systems worldwide. The virus primarily spreads through the respiratory droplets, causing a range of symptoms from mild respiratory issues to severe pneumonia and even death. How it can be transmitted and how the symptoms will look like. So the virus primarily spreads through the close contact and respiratory droplets when an infected person coughs, sneezes, or talks, breathes. Common symptoms include fever, cough, shortness of breath, fatigue, and loss of taste or smell. However, the spectrum of symptoms varies widely, with some individuals being asymptomatic carriers. Global spread and impact: COVID-19 quickly spread across continents, leading to the World Health Organization to declare it is a pandemic in March 2020. Nation implemented various measures such as lockdowns, travels, restriction, and social distancing to curb transmission. The pandemic exposed vulnerabilities in healthcare system and highlighted the need for global cooperation in addressing such crises. Healthcare systems worldwide face unprecedented challenges as they grappled with surging cases. Hospitals deal with shortages of medical supplies, ventilators, and intensive care beds. Frontline healthcare workers demonstrated remarkable dedication, often working tirelessly to provide care under extreme circumstances. Vaccination development and distribution for COVID-19. Scientists and pharmaceutical companies collaborated at an extraordinary phase to develop and test COVID-19 vaccines. By utilizing various platforms including messenger RNA and vector-based technologies, vaccines were developed and authorized for emergency use within a remarkably short time frame. Mass vaccination campaigns commenced, aiming to achieve widespread immunity and control the virus spread. In this paragraph, I'm going to tell you about the variants and adaptation of virus. As the virus spreads, multiple variants emerge, some with altered transmission dynamics and potential impacts on vaccine efficacy. This necessitated ongoing surveillance and adaptation of vaccine strategies to address the challenging landscape of the pandemic. Social and economic implications: the pandemic's social economic implications were profound. Lockdowns and restrictions led to job losses, business closure, and disruption in education. Government implemented stimulus packages to alleviate economic hardship, but recovery remains a complex and ongoing challenge. Mental health and well-being: the pandemic took a toll on mental health, with feeling of isolation, anxiety, and depression becoming prevalent. People coped with extended periods of uncertainty, loss, and disruption, leading to increased awareness of the importance of the mental health support. Remote work and digital transformation. The pandemic accelerated the adoption of remote work and digital technologies across industries. Companies and educational institutions pivoted to online platforms, leading to shifts in work culture and the acceleration of digital transmission trends. Disparities and vulnerable population. COVID-19 exposed and exacerbated existing social and health disparities. Vulnerable population, including the elderly, low-income individuals, and minority communities, face disproportionate effects due to limited access to healthcare, higher exposure risks, and systemic inequalities. International collaboration. The pandemic underscored the need for international collaboration in sharing information, resources, and expertise. Initiatives like COVAX aim to ensure equitable access to vaccine for all nations, emphasizing the importance of globally solidarity and addressing a global crisis. Lessons in preparedness. The pandemic highlighted the importance of pandemic preparedness and early response system. Governments and organizations around the world have been urged to invest in healthcare infrastructure, research, and coordinated strategies to mitigate the impact of future health crises. Evolving researches continue to investigate various aspects of the virus, including its origin, transmission dynamics, and long-term effects on survivors, resulting in a deeper understanding of the virus behavior and potential treatments. Looking ahead, as vaccination efforts continue and societies adapt to the new normal, questions remain about the virus' long term behavior, the durability of the immunity, and potential for future outbreaks. Flexibility and ongoing vigilance will be crucial in managing future challenges. Resilience and hope. The global response to COVID-19 demonstrated humanity resilience and capacity for innovation. While the pandemic brought hardship and loss, it also highlighted the power of scientific collaboration, community support, and human determination to overcome adversity and emerge stronger on the other side. Now, COVID-19, short for coronavirus disease, 2019 is a highly contagious viral illness caused by the severe acute respiratory coronavirus 2, short SARS-CoV-2. It emerged in Wuhan, China in late 2019 and quickly spread globally, evolving into a pandemic. This unprecedented event has had profound and far-reaching effects in individuals, communities, and societies worldwide. In this video, we will explore various aspects of COVID-19, including its origin, transmission, impact on public health, economy, and society, as well as the global response to combat the virus. So, first of all, origins and spread. COVID-19 is believed to have originated from a seafood market in Wuhan, which is located in China, where the live animals were also sold. The virus likely made a zoonotic leap from an animal host to human, although the exact source is still debated. Transmission: how this virus can be transmitted from one person to the other person. So the virus primarily spreads through respiratory droplets when an infected person cough, sneeze, or talks to anyone. It can also spread by touching contaminated surfaces and then touching the face, especially the eyes, nose, and mouth, which is the sensitive areas to the viruses, and it is called an infecting triangle. Symptoms and severity. Symptoms vary widely, with some individuals remaining asymptomatic while others experience mild to severe respiratory problems, ranging from fever, fatigue, and loss of taste or smell to more severe cases that can lead to pneumonia and acute respiratory distress syndrome, often requiring intensive medical care. Global impact: how the virus globally impacted. The pandemic has had a staggering global impact, leading to widespread illness and death, overloading healthcare system, and causing significant social and economic disruptions. Public health response to the virus is: governments worldwide implemented various strategies to curb the virus spread, including lockdowns, travel restriction, mask mandatory, and vaccination campaigns. These measures aim to flatten the curve of infection and protect the vulnerable population. Vaccination efforts: the development and distribution of COVID-19 vaccine were monumental achievements in record time. Vaccination campaigns have been crucial in reducing severe illness and slowing transmission. Economic consequences: the pandemic triggered a global recession, causing job losses, businesses closure, and economic instability. Government implemented stimulus packages to mitigate the economic fallout. Now, how the virus affect the education. Education disruption: COVID-19 disrupted educational system with widespread school closure and a shift to online learning. This had implications for students' academic progresses and mental health. Mental health impact: the pandemic has taken a toll on mental health, leading to increased rates of anxiety, depression, and loneliness due to isolation and uncertainty. Healthcare workers played a heroic role in battling the pandemic, often working long hours under extreme stress and risking their own health. Disparities: COVID-19 exposed and exacerbated existing healthcare and social inequalities, disproportionately affected marginalized communities and low-income individuals. How it affects long-term. Some COVID-19 survivors continue to experience lingering symptoms known as long COVID, which can include fatigue, brain fog, and respiratory issues. Global cooperation: the pandemic highlighted the need for global cooperation in the face of a shared threat. Initiatives like COVAX aim to ensure equitable vaccine distribution worldwide. Future preparedness: COVID-19 underscored the importance of pandemic preparedness, prompting discussion about bolstering healthcare infrastructure, surveillance systems, and research funding. The last point is hope and resilience. Despite the challenge, the pandemic showcased human resilience and the ability of science innovation to address crises. Communities came together to support one another, and the global response demonstrated the power of collaboration in confronting a global health crisis. Now we are going to conclude our topic about COVID-19 is a historic event that has reshaped the world in numerous ways. It has exposed vulnerabilities in our healthcare systems, highlighted the importance of science and globally cooperation, and challenged societies to adopt and respond to an unprecedented crisis. As we move forward, the lesson learned from this pandemic will undoubtedly shape our approach to future health emergencies and our understanding of the interconnectedness of